In a previous episode, where we were continuing our series on non-communicable diseases with Dr. Kiran Bhagat, we discussed diabetes, a condition that comes about when the body does not produce enough insulin to mop up the sugar in the bloodstream to convert it to energy. Tonight, we move on to cancers with Dr. Kiran Bhagat, where he shares his insights on why the prevalence of various forms of cancer is on the rise.
Cancer is essentially the inability of a cell to switch off. It, if you like, in very simple terms, becomes immortal. It is able to replicate and continue to replicate itself and to grow. So cancerous tissue is a tissue that has not known its limits. You know, a portion of the skin that doesn't know its limits becomes a skin cancer. A portion of the breast tissue that doesn't know where to limit its breast contour becomes a breast cancer. And that really is basically where a cell immortalizes, learns how to become immortal, and the issue is what triggers that immortality and begins to grow. The issue in terms of the World Health Organization is that it is now seeing a rapid rise in cancer as being one of the commonest reasons for non-communicable disease after, heart disease and diabetes. Cancer is there right at the top. And one has to ask the question, is it that we're picking it up more? Is it that we have technology to pick it up? Or is it really on the rise? And the issue is, I think, a bit of both. We're now beginning to see women educated about breast examination or feeling a lump and going to a health facility and picking it up earlier. But also we're beginning to appreciate that the same lifestyle issues that have caused heart disease and diabetes are also impacting in a different way in terms of the cancers that we're seeing. Two of the commonest causes of cancer are breast cancer and lung cancer. And we know one of the, other than genetic, and we know that there's a strong genetic overlay in terms of breast cancer, and the classic case is what's called the BRCA gene. We know that there are certain genes that predispose towards having breast cancer at a very, very high risk. So high that in some women have taken the choice of actually undergoing a double mastectomy, because the incidence is between 45 to 50% if you carry that gene. And we're able to test for that gene in Botswana. But that represents a smaller portion compared to lifestyle. We are aware, for example, that lack of breastfeeding increases the risk of breast cancer, because we know that as you breastfeed, you're opening up the ducts. We know that you are servicing, if you like, that part of nature that was supposed to be serviced. We know that women who are obese are much more likely to develop cancer because of the hormonal changes that occur during obesity, affecting menstrual cycles in terms of affecting the hormonal profiles, and as a result we're seeing a much higher incidence of breast cancer in those that are obese. In terms of lung cancer, we know that the commonest cause of lung cancer is tobacco. And as a result of education about the nasty effects of tobacco in North America and Europe, many of those industries have now turned their eye very firmly on Southeast Asia and Africa in terms of plugging their tobacco products. We've talked about the cheap tobacco that's available. We've talked about the vaping in our past episodes. These are industry preying upon an uneducated population for consumption. So this is an issue in terms of the lung cancer that we see. We know that asbestos, people who lived in asbestos homes are much more likely to develop lung cancer. We know that, unfortunately, in some poorer parts of our continent and maybe in our country, wood-fired kitchens within a closed space, we know children are much more likely to suffer not only asthma but also from cancer. So many of the environmental impacts of industrialization are being seen as a result of the rise of the cancers that we see. We do know that certain infections cause cancer. We know that HIV causes certain types of cancer. We know that the human papillomavirus from sexually transmitted disease can cause cervical cancer. We know that hepatitis causes certain types of liver cancer. So we know that there are certain infections that can predispose towards cancer. But remember, cancer is pretty much like all the other lifestyle diseases that we talked about, where the genes, if you like, are the bullets in your gun. But the environment is the thing that pulls the trigger. So if you know that you are genetically predisposed towards breast cancer or lung cancer or even diabetes, it's incumbent on you to ensure that you get the right education, the right tools to prevent it from occurring. Because the environment often triggers it. If you know that you need to cut your salt and exercise, lose weight, avoid smoking, not taking too much alcohol, because you have the genetic predisposition towards these conditions, this is where we see 21st century medicine working its magic. That is what we see in terms of cancer. And cancer is moving very rapidly in terms of early detection. But cancer is one of the most expensive branches of medicine. It is, once you are labeled as having cancer, those that are listening to the program that are unfortunate victims of this cancer know that you continue going for checkups, you continue going for cancer therapy, whether it's regular, whether it's monitoring, whether it's radiotherapy, whether it's chemotherapy. We know sadly, unfortunately, in the past that cancers that go into remission may relapse again, 10, 15 years later. So these are issues that we're trying to prevent at a much early stage. And like the programs we've talked about before, we want to try and go upstream to see what has caused all of these rises in the cancers and where can we go to start preventing some of the things that we see today. And I think with cancer, primarily, it is lifestyle in terms of the alcohol and the tobacco and the sugar and the exposure to industrial chemicals that we see, as well as the lifestyle measures that we put in place for hypertension, diabetes and obesity.
So how do these various forms of cancers present? What can be some of the symptoms that one needs to look out for?
That technology, I think because cancer has spread, has risen very rapidly, and it's sad to say, but it's true, that because it's an expensive branch of medicine, much investment has occurred in it. It's not very sexy to talk about blood pressure or to talk about diabetes because it's much more about what the patient can do. Yeah. In terms of cancer, the industry, both artificial intelligence technology as well as the chemical industry, the chemotherapy industry and the radiotherapy where you give radiation cancer has moved rapidly because these are treatment options that are available. And so cell biology, cell chemistry, laboratories measuring cancers in the blood, for example, doing a PSA for prostate cancer, doing a breast biopsy for breast cancer, has moved very rapidly in terms of technology to pick it up very quickly. Mammography in terms of doing ultrasound of the breast, ultrasound of the prostate. These have moved very rapidly. And I think one needs to ask the first question as I talk as a preventive, why are they occurring first rather than picking it up early? Why don't we try and prevent it? But they are being picked up early because of the technology, because we can send a blood sample to a lab and measure the genetic portfolio, the chemicals, what we call the proteins that the chemicals of cancer release, the prostatic specific antigen in prostate cancer, some of the breast cancer markers, the CA125, this is a breast cancer marker, ovarian cancer, lung cancer, you get them to spit out some of their spit and send it to the lab, just like we look for tuberculosis, you can actually look for cancer cells within the spit itself. Saliva is being used as well. Stool, in terms of measuring blood in the stool, in terms of measuring chemicals that are released from bowel cancer in the stool, we can actually measure these and pick them up. We've talked about in our previous episodes where the Japanese have invented a very smart toilet where, it knows what your poo normally looks like, and then it has chemical indexes around the pan that picks up abnormal chemicals and gives an alert to say there's something wrong with your poo. Is it that you're bleeding? Is it that you have a growth? So this is technology that's coming to the fore. We will see it, hopefully in this part of the world, but that's where cancer is being picked up much earlier.
You've just spoken about, that there's early detection of cancers. I want you to speak to the symptoms and how they can be detected early.
I think many of the cancers today, there's very exciting, and I speak as a non-cancer specialist, there are very many exciting technologies coming in to cancer medicine to actually cure cancer. There are certain blood cancers, if you like, liquid cancers we call them, that are curable. The leukemias, the lymphomas that occur in the circulation. Many cancers, unfortunately, are not curable, but we are able to manage them and give patients a better, longer, more quality life, if you like. And that leads to the branch of palliative care where you actually care for the dying. But certainly I think there are advances in understanding the way cancers are growing, understanding what immortalizes that cancer, what makes that cancer trip up into being able to replicate and not stop replicating. And recognition of that has now developed technology and armor, if you like, that you can actually inject in the circulation and goes, if you like, to the cancer and picks it up and destroys the cancer, a bit like, this Star Wars type technology that is going to develop, but it's very expensive technology. It's called immunotherapy, and we may have it in the future, but it's going to be beyond the reach of many of us in the global south, if you like.
With these cancers, are they preventable or even curable?
Prevention is where we're at with this series, and I think there are a three-pronged approach in terms of prevention of cancers, just like the other diseases. One is lifestyle, and understanding and education of what lifestyle factors impact on cancer. What is it that I'm swallowing, that I'm breathing, that I'm exposed to that can cause it? Am I exposed to chemicals that I'm applying to my skin? We know that, for example, cheap lipstick contains high quantities of thallium and lead, and swallowing, and we know women apply lipstick on a daily basis. If you're swallowing that lead and thallium into your circulation, you can cause cancer. We know that certain types of recycled products contain what are called bisphenol chemicals, which can actually cause cancer. So recycled plastic. What bottles are you consuming your water from? Where is the recycled plastic coming from? The chemicals that we put in the soil, the insecticides, the fungicides, the pesticides, go into the roots. And what are the concentrations of the foods that contain these chemicals? In terms of the breathing, in terms of ventilation, in terms of the kitchens that our mothers are cooking in, both out there in Moraka and Masimu, are they using wood-fired ovens? Is it ventilated? Are these children being exposed to this? Is asbestos banned in terms of the roofing? Are our mining industry being careful in terms of the occupational hazards? Are they doing lung function tests? Are they checking for industrial exposure? These are, again, national and political and governmental issues rather than medical issues that can start in terms of prevention. From a medical perspective, yes, there are many things that are available, and certainly in Botswana as well. A classic one is the human papilloma vaccine. Human papilloma virus vaccine, where we give young girls and even men now who are not yet sexually active the HPV vaccine to prevent cervical cancer, and it's highly effective. We know that certain types of the hepatitis vaccine can prevent hepatitis from occurring, and as a result prevent hepatitis-associated liver cancer. So many vaccines will be available to prevent cancers in the future, some available currently in terms of management. But the primary thrust has to be education, lifestyle, and managing exposure to what we see in our environment and what we put inside our bodies.
This program was brought to you in association with First National Bank of Botswana.